Bree is cradling our arms right now, sweating over the lower arm muscles, as you will too. You will too. But I'm going to try to take you through this. As you can see, there's lots of small muscles in the lower arm. We do spend some time thinking about these ones because they're so important for the movement of the hand, which is, tool usage in the humans. So I want to take you through a couple of terminology things here. One of the things is anatomical position. If you're in anatomical position, remember the thumb is going to be lateral. And if you have the thumb lateral, that means that the radius is also lateral and that the ulna is medial. Now, what we're going to remember for this is that the radius is the thumb side and the ulna is the pinky side. So just keep that. I know that doesn't make any sense at the moment, but wait for it. So the first muscle we're going to be focusing on is going to be the pronator teres, which is a muscle that almost goes sideways here. The pronator teres is almost like it's a sideways muscle. It's kind of really a different muscle. I usually start with that one. The next one we're going to be looking at is the brachioradialis, which is the largest muscle of the lower arm, the brachioradialis. And the tricky part here, you guys, is that, or folks, is that the muscles here, the muscle models are actually backwards from the pictures in your book. So you're going to have to, unfortunately, turn it around. So again, the pronator teres. The next one is the brachioradialis. This is the largest muscle of the lower arm. The next one we're going to be looking at is the flexor carpi radialis. The flexor carpi radialis. Now, the word radial is in there. So remember that this is going to be inserting on the radius side, basically into the thumb. So let's follow it up. Okay. And there's your flexor carpi radialis. And the other clue with this one is it's called a flexor, which, think about the movement that is allowed in your hand. You want to show us a flexion? Yep. So when we flex, we are, bringing two bones closer together, basically, increasing or decreasing the angle between them. So flexors are going to be the anterior surface of your hand. The other flexor we're going to look at is the flexor carpi ulnaris. We say ulnaris, that means it inserts on the ulna side or on the pinky side, and there it is, the flexor carpi ulnaris. Yep. The last of these we're going to be looking at is the palmaris longus. The palmaris longus, as the name suggests, inserts directly into the palm. Although there's a break there, you can kind of use your imagination and see the insertion point is going to be into the palm. All right, so brachioradialis, pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. So yeah, on the anterior surface, you actually have to get to know 5 different muscles like this. Let's turn to the posterior side. There's only 2 we're going to be looking at on the posterior side, and they are both extensors. So the extensor digitorum, as the name suggests, it's going to be inserting directly into the digits. It's going to actually have 3 insertion points in 2, 3, and 4. And yep, so that's your extensor digitorum. Remember, extension allows us to open up the hand, right, to increase the angle between muscles, if that makes sense. So flexion is an anterior thing, extension is a posterior thing as far as the hands are concerned. The next one we're going to take a look at is the extensor carpi ulnaris. So again, we see that ulna, pinky side. There's our extensor carpi ulnaris. Well done. Good job.